Hi, today we will have a practical session on tongue creep. My aim is to demonstrate the fabrication of a tongue creep removable appliance, including its design principles and the key steps in its construction. I also believe that practice should be supported by theory. So we will review a common pernicious oral habit and understand its effects on dental and craniofacial structures. I would like you to scan the QR code and let me know what are types of oral habits. Previously, we had a 1 hour lecture on oral habits. Could you recap what we have learned? Great job! I'm glad you still remember the different types of oral habits. When these habits continue for long periods, they can alter tongue posture, muscle balance, and pressure on the teeth, eventually affecting dental alignment and occlusion. Therefore, identifying and managing these habits early is an important component of orthodontic treatment. Let's look at a real case that you may encounter in the clinic. As shown in the video, the tongue thrusts forward during swallowing. If this habit is not corrected, it can hinder attempts to correct the malocclusion. This tongue creep, fabricated by one of my students, acts as a barrier that prevents the tongue from thrusting forward. It encourages the tongue to reposition more posteriorly and superiorly against the palate. As seen in the video, the tongue creep helps retrain the patient's muscle pattern and swallowing behavior. Wonderful, isn't it? If you have been following what I've been saying so far, you should be able to answer this question. Where should the tongue be at rest? Scan the QR code and let me know. Tongue posture varies among individuals. In normal posture, the tongue tip rests on the incisive papilla and the dorsum lies gently against the palate. Abnormal postures may occur. If the tongue rests against the palatal surfaces of the upper incisors, it can cause protrusion of the upper front teeth seen in high tongue postures. Meanwhile, in horizontal posture, the tongue presses against the lower incisor edges, leading to protruded upper incisors and an anterior open bite. In the low tongue posture, the tongue rests against the lingual surfaces of the lower incisors, causing them to protrude. In a very low posture, the tongue sits along the lower alveolar ridge and fails to counteract lip pressure, resulting in a retroclined lower incisors. Tongue creeps are used for high or horizontal tongue posture, while spurs are used for low or very low tongue posture. Now, let's consider a clinical case. This is a 33-year-old Indian male patient who presented with a chief concern of a gap between the upper front teeth. What do you see from the clinical photos? Yes, you see spacing at the upper teeth. Also, there is a reduce in vertical overlap of the upper front teeth with the lower teeth, but no anterior open bite. You can see that the lower teeth are also unaffected. So which tongue posture does this patient have? Yes, very likely a high tongue posture. Thus, we need to correct the tongue posture because if the tongue consistently pushes against the anterior teeth, it can prevent space closure and maintain the diastema. Do you now understand the reason for advising a tongue creep in this case? Let's design an appropriate appliance. Do consider the various components required. First, we need active components, which is the crib, to stop the habit, and also a short labial bowl to close the space. Second, the appliance must include appropriate retentive components. Do you remember what class we should fabricate? Yes, Adam's class on the upper first molars. Lastly, The appliance should still allow normal speech and swallowing, so we must have the base plate as thin as possible but covering adequate palatal surface. You can design it as a horseshoe shape or a full palatal coverage base plate. This is how the appliance would look like at the end of the session. Please ensure clarity in your instructions to the technician so that you will get what you require. The next stage is fabrication. Fabricating a tongue crib involves several laboratory steps, including preparing the wax template, bending the wire components, and assembling the appliance. Let's go through these steps one by one. The first step is to create the wax template. This step is important because the wax template determines the final position and orientation of the wire components. The wax should extend from canine to canine, covering the entire palate where the crib will be placed. It must also extend sufficiently inferiorly to keep the tongue from positioning itself below the crib. For the next step, you need to straighten a 0.8 mm stainless steel wire. Then, form the crib using the wax template as a guide. Make 5 uniform loops, and once completed, you adapt the crib to the working cast. It should look like this. I went around looking at your cribs. Let's have a look at what went wrong with some cribs. When you look at this crib, you can only see 4 loops, which is not enough. The reason why this happened is because your loops are too wide, so there was inadequate space to fit 5 loops. Next time, you have to carefully measure the size of the loop. Let's look at another example. Can any one of you determine what is the problem with this? Yes, the height of the loops should follow the contour of the palate and provide an effective barrier for the tongue. This last photo shows a perfect example of a properly fabricated crib, demonstrating the correct number of loops and appropriate spacing. Correct loop formation is important because it determines how effectively the appliance restricts tongue thrusting. Well done, Samantha, in your fabrication of this crib. These are 2 cribs from the back view. What do you notice? The loops are too long and is poking the lower gum. The crib has to be remade as the patient will not be able to wear it, as the loops will cause discomfort to the patient. So we have come to the final end of the practical session. Let me summarize what we have learned today. There are different types of tongue posture. They could be normal or abnormal tongue posture, such as high, horizontal, low, or very low. And the effect of abnormal tongue posture could be due to the proclination of the upper teeth, leading to anterior open bite and also spacing. It also could affect the inclination of the lower teeth. There are 2 approaches to management of tongue posture. The first would be restraining, which is the tongue crib that we have fabricated or learned today. The second would be orientating, which is spurs. Both methods aim to retrain tongue posture and function over time. Do you have any questions? No? Let me then ask a question to test your understanding. This is an easy one. So which habit are we trying to stop in this case? Scan the QR code and please answer now. These are the references used for this presentation. I'd like to encourage you to go back to read it. Also, we do have a video which is available in the eLearn portal. It illustrates the instructions when issuing the appliance to patients. Clear instructions must be given because patient's compliance is critical for the appliance to be effective. Just a quick reminder, believe that you can and you're halfway there. I would like to have your feedback before we end this session. Please scan the QR code to let me know how you feel about today's lesson. I also want you to reflect what can be improved from the work you produced today and how you can achieve that improvement. Pernicious oral habits such as tongue thrusting can significantly affect dental alignment. Therefore, the tongue crepe is a simple but effective appliance used to manage this condition by restricting forward tongue movement and encouraging proper tongue posture. Also, do remember that successful treatment requires diagnosis, proper appliance design, precise fabrication, and good patient compliance. I hope you enjoyed the lesson and thank you for your kind attention.